This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am Abhishek Mukhopadhyay and with me is Renuka. The headlines. Massive evacuation operation Vande Bharat mission to bring back stranded Indians from abroad continues. 129 evacuees brought to Delhi from Dhaka, nearly 850 flying back to Lucknow, Hyderabad and Kochi from Gulf countries tonight. Health Ministry issues revised discharge policy for COVID-19 patients. Very mild and moderate patients can be discharged without test. Health Minister Dr. Vardhan appreciates efforts of northeastern states in containing coronavirus pandemic. Minority communities contributing equally in fight against COVID-19, says Minority Affairs Minister Mukhtar Abbas Naqvi. And Civil Aviation Minister Hardeep Singh Puri asserts preparations in place to restart domestic flight operations. The massive evacuation operation Vande Bharat mission continued in full swing on the third day. Under the mission, which has been conducted by the Government of India, thousands of Indians stuck in different parts of the world have been brought back in the wake of COVID-19 pandemic. The second flight from Dhaka with 129 Indians landed in Delhi this afternoon. The evacuation of stranded Indian nationals from Bangladesh began with the arrival of 168 students in Srinagar on the first flight yesterday. 5 more flights with nearly 850 people are flying back to Lucknow, Hyderabad and Kochi from the Gulf countries tonight. 3 flights will land after midnight. All the evacuees will be tested by the medical teams and were quarantined as per the safety protocols issued by the Union government. Our West Asia correspondent reports that the mission has provided much needed relief to Indian expatriates of the Gulf during the coronavirus pandemic.
From Sharjah, 2 infant, 180 distressed Indians, including workers who lost their jobs, pregnant women, aged people, medical emergency cases, took off for Lucknow this evening. One of the passengers who tested positive was not allowed to check in. A special ambulance of the UAE government took him away for isolation. The entire area was disinfected soon after. There were some waitlisted people, mostly blue-collared workers, who could not be so lucky as the flight was packed to its capacity. Meanwhile, a tweet by Indian consulate in Dubai said that 88 doctors and nurses who are on UAE residency visas and working in the Emirates are coming back by special flight tonight. This will strengthen the hands of the frontline workers in the war against COVID-19 in the UAE. Kanchan Prasad, AIR News, Dubai.
In Uttar Pradesh, a flight under Vande Bharat mission from Sharjah will be landing shortly in Lucknow. The flight is bringing back stranded Indians and arrangements have been made to receive the passengers at the Chaudhry Charan Singh Airport. Our correspondent has more on this.
The flight with 200 passengers from the city of Sharjah in United Arab Emirates will reach at Chaudhry Charan Singh Airport in a short while from now. State Civil Aviation Minister Nand Gopal Gupta Nandi said that team of medical experts with PPE kits and other medical equipments will be there at the airport, and after screening, passengers will have option to go to their native places by paid taxi and bus service and will be quarantined there. The passengers on the flight will also have option of either be quarantined in Lucknow for 14 days in a government center or in hotels that will charge them a reasonable amount. District Magistrate of Lucknow, Abhishek Prakash, said that hotels have been divided into 3 categories and all 3 categories will charge a very reasonable rate. Sushil Chandra Tiwari, AIR News, Lucknow.
The Telangana government has made all arrangements to receive and quarantine over 2,000 stranded Indians who are coming home from various countries. The first flight from Kuwait will be arriving at Shamshabad International Airport shortly. Our correspondent says over 150 people are going to come by the Air India flight.
Over 2,000 stranded Indians will be reaching Telangana state during next 1 week under the Vande Bharat mission. The first flight will bring home over 150 passengers who are stranded in Kuwait due to lockdown. An Air India flight left Shamshabad airport this morning to bring stranded Indians to Hyderabad. The airport health organization has made all arrangements to conduct a thorough health screening and also shifted to medical facility if any passenger found symptomatic to COVID-19. The state government has also also made elaborate arrangements for compulsory institutional quarantine of these passengers. They will be given choice for the same to opt for budget hotel or government quarantine facility for next 14 days. State-run passenger buses have been kept ready at the airport to shift the arriving passengers to quarantine facilities too. Lakshmi, AIR News, Hyderabad.
As part of the Vande Bharat mission, 2 flights carrying around 400 expatriates from Gulf regions will be arriving at Kochi in Kerala soon. We have a report.
Flight from Muscat carrying 220 passengers, followed by flight from Kuwait with 180 passengers, is about to arrive in Kochi International Airport soon. The airport is fully equipped for the screening and transfer of returnees to quarantine centers following the WHO COVID-19 exit protocols. Another flight from Doha is also scheduled to arrive in Kochi early morning at 1:40 am tomorrow. Meanwhile, 2 more COVID-19 cases are confirmed in Kerala. The newly confirmed cases are people who had returned from Abu Dhabi and Dubai to Kerala on 7th May and presently under treatment in hospitals in Kochi and Kozhikode. Chief Minister Pinarayi Vijayan said that the situation is serious and called for high alert. Mr. Vijayan said that all precautions are being done and that the newly confirmed patients were directly shifted to hospitals on showing symptoms in the medical screening in the airport, and all the fellow passengers are in strict observation in quarantine centers. Mayusha for AIR News from Thiruvananthapuram.
The arrival timings of the first Vande Bharat flight to Trichy has been slightly changed. As per the present schedule, the flight is expected to fly into Trichy from Kuala Lumpur by 9:40 p.m. tonight. The flight is carrying over 170 passengers. Stranded Indians being repatriated from abroad are very happy. The travellers expressed gratitude towards the Government of India for providing help in difficult time. Talking to a Dhaka correspondent, a distressed traveller appreciated the Indian government for making very good evacuation arrangements.
Today, the Indian government, along with the Indian High Commission in Bangladesh, has organized the evacuation from Dhaka to Delhi. It has been quite well organized and well planned by the Indian High Commission. I'd like to thank the High Commission as well as the Indian government for organizing the same. Looking forward to reach Delhi and to be with my family after 2 weeks of quarantine in Delhi.
Another passenger on board a flight from Muscat to Kochi is travelling to be with a critically ill mother. She thanked the government for facilitating her return to India to be with her mother.
I'm Shibi. I'm travelling to Kochi. My mother is critically ill and she is in supportive care. I'm really thankful to the government of India and the Indian embassy here for giving me this opportunity to travel. I'm really grateful to all the help that I have got. I'm really thankful. I have really no words to express my gratitude. Thank you, everyone.
In the world's largest evacuation plan, Vande Bharat mission, the government in the second week of evacuation commencing from 16th of this month will repatriate approximately 25,000 people. Around 106 flights, including from Canada, Russia, Europe, Australia, US and Gulf countries will bring back stranded Indians from these countries. In the first week of the Vande Bharat mission, which started from 7th of this month, around 15,000 people from 12 countries are being evacuated. More details from our correspondent.
The second week of Vande Bharat mission will be both more extensive and exhaustive. With maximum number of stranded Indians in the Gulf countries, the thrust area would, however, remain same. Second phase of the repatriation exercise by the government will witness 11 flights to the UAE, including 7 to Dubai, 6 flights to Saudi Arabia, 2 to Bahrain, 3 to Kuwait, 7 to Oman, and 3 to Qatar will bring back people to their homeland. Plans to operate 21 feeder flights within the country is also being discussed, which will carry the passengers close to their home cities. In addition, flights to Melbourne, Sydney, Moscow, Toronto, Vancouver, Lagos, Paris, Dublin and Almaty are being slated in the second week of the evacuation. Government, through its missions and embassies in these countries, is working out to get the green signal for the movement of Air India flights. Tomorrow, on the fourth day of the Vande Bharat mission, 10 flights will be flying off from Riyadh, Dhaka, Doha, Kuwait, Kuala Lumpur, Singapore, Manila, London and Newark and will bring back Indians to the country. Anand Chaturvedi, AIR News, Delhi.
INS Jalashwa, carrying 698 Indian nationals from Maldives' capital of Malé, will reach Kochi tomorrow morning. The evacuation is part of Indian government's program to evacuate Indians stranded abroad. The program, named Samudra Setu by Indian Navy, entails to bring back around 2,000 Indians in 4 ships from Maldives. Another ship of Indian Navy, INS Magar, is expected to depart from Tuticorin tomorrow, and preparations have also begun. The 2 ships will repeat the exercise next week, carrying another 900 people back. A report.
Preparations are in full swing for evacuation of Indian nationals from Maldives through the second Indian Navy ship INS Magar. The evacuation, part of Samudra Setu under Vande Bharat mission, will bring back another around 200 Indians to Kochi. Indian High Commission in Male is busy giving final touches for the arrangements, and it released the list of 211 probable passengers for tomorrow's journey. The first ship INS Jalswa had left Male last night and is expected to reach Kochi tomorrow morning. The ship is carrying 698 Indian nationals, including 19 pregnant women and 14 children. The second leg of Samudra Setu will happen next week, when both ships will return to Maldives capital, carry similar number of passengers back to Tuticorin in Tamil Nadu. In this whole operation, Maldives government and local youth volunteers have played a very important role, thus further deepening the excellent bilateral relations between the two neighbors. Santosh Kumar for AIR News from Colombo.
Health Ministry has issued revised discharge policy for COVID-19 patients. As per new policy, very mild and moderate patients can be discharged without COVID-19 test, subject to clinical conditions. Very mild and pre-symptomatic cases admitted to a COVID care facility will undergo regular temperature and pulse oximetry monitoring. The patient can be discharged after 10 days of symptom onset and no fever for 3 days. There will be no need for testing prior to discharge. The patient will be advised to follow the home isolation for further 7 days. If they develop symptoms of fever, cough or breathing difficulty again, they must contact the COVID Care Centre State Helpline or 1075. As per the revised policy, the moderate cases will undergo monitoring of body temperature and oxygen saturation. If the fever resolves within 3 days and the patient maintains saturation above 95% for the next 4 days, the patient will be discharged after 10 days of symptom onset, provided there is no fever or breathlessness. Health and Family Welfare Ministry said the 17,847 patients have been cured so far, and the recovery rate from COVID-19 reached to 29.91%. To the last 24 hours, 95 deaths have been reported, taking the nationwide toll to 1,981. A total of 3,320 new confirmed cases of novel coronavirus have been reported in the country to the last 24 hours, taking the total number of cases to 59,662. Health Ministry data issued this morning said the number of active COVID-19 cases stood at 39,834.
Union Health Minister Dr. Vardhan today held a high-level meeting with northeastern states through video conferencing to review the status of COVID-19 in the region, along with the measures being taken for its containment and management. The states include Arunachal Pradesh, Assam, Manipur, Meghalaya, Mizoram, Nagaland, Tripura and Sikkim. During the meeting, Dr. Vardhan appreciated efforts of northeastern states in containing coronavirus pandemic. He said it is a huge relief and very encouraging to see green zones in most northeastern states. He said till date only Assam and Tripura have active COVID-19 cases and the other states are all in the green zone.
I had gone through the details of the northeastern states and it's a very good performance. We are so happy about it. We have to maintain the status, and wherever we are still in the orange zone, we have to take it up to the green zone. I am so happy to know that all the 8 states together, they have just about 194 cases. Sikkim and Nagaland, they continue to remain unaffected.
This is All India Radio bringing you a special program on COVID-19. Before we move on, a reminder of the headlines. Massive evacuation operation Vande Bharat mission to bring back stranded Indians from abroad countries. 129 evacuees brought to Delhi from Dhaka. Nearly 850 flying back to Lucknow, Hyderabad and Kochi from Gulf countries tonight. Health Ministry issues a revised discharge policy for COVID-19 patients. Very mild and moderate patients can be discharged without test. Health Minister Dr. Vardhan appreciates efforts of northeastern states in containing coronavirus pandemic. Minority communities contributing equally in fight against COVID-19, says Minority Affairs Minister Mukhtar Abbas Naqvi. And Civil Aviation Minister Hardeep Singh Puri asserts preparations in place to restart domestic flight operations. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Minority Affairs Minister Mukhtar Abbas Naqvi has said that minority communities are equally contributing in the fight against COVID-19 along with others. Mr. Naqvi said that people of the country are working together and strongly to defeat the challenge of corona pandemic on the appeal of Prime Minister Narendra Modi. He said over 1,500 healthcare assistants trained under skill development program are assisting in treatment and well-being of corona patients. These include 50% girls. He said 16 Hajj houses across the country have been given to state governments for quarantine and isolation facilities for corona-affected people. Mr. Naqvi said Aligarh Muslim University Medical College has also arranged 100 beds for treatment of corona patients and arranged corona tests. The minister said more than 9,000 tests have been done till now at the AMU Medical College. He said that different Waqf boards across the country have contributed 51 crore rupees in PM and CM relief funds for corona pandemic with the support of various religious, social and educational organizations. The Waqf boards are also distributing food and other essential commodities among the needy. Civil Aviation Minister Hardeep Singh Puri has said that preparations to restart domestic flight operations are in place, and as soon as a decision is taken in this regard, the industry will be able to take off immediately. Talking to a private channel, Mr. Puri said the ministry also foresees changes in the way people who travel with strict adherence to social distancing norms. He said there will be changes in SOPs related to flight operation. The minister informed that once the airports would reopen, long queues would not be allowed. People shall be asked to reach airport well before the normal time, whereas baggage entitlement might be reduced and meal services may be stopped. He said all these things will be finalized after consultation with the airlines. Mr. Puri added that a calibrated reopening can happen after the lockdown.
In view of lockdown, the evacuation for class 10th and 12th board examinations will be done at home by the teachers. Over 1.5 crore answer sheets of already conducted exams will be delivered at the homes of teachers for evaluation. This was announced by Human Resource Development Minister Ramesh Pokhriyal Nishank today. He said 3,000 evaluation centres have been identified by the CBSE from where answer sheets will be sent. He said this process will start from tomorrow and it is likely to be completed within 50 days. He expressed confidence that the results of class 10th and 12th board examinations will be declared soon. Home Minister Amit Shah has refuted all rumours regarding his health concern. In a tweet, Mr. Shah said the country is currently fighting a global epidemic like corona, and as the Home Minister of the country, he does not pay attention to such rumours due to a hectic work schedule. Mr. Shah said that he is perfectly healthy and is not suffering from any disease. He expressed gratitude towards well-wishers and party workers for their concern. The minister also stated that he has no ill will or malice towards the people who spread rumours related to his health.
Home Minister Amit Shah has told West Bengal Chief Minister Mamata Banerjee that a government is not allowing the trains reaching West Bengal is injustice to migrant labourers. In a letter to Ms. Banerjee, the Home Minister said this will create further hardships for labourers. He said the centre has facilitated more than 2 lakh migrants to reach home. He said migrants from West Bengal are also eager to reach home and central government is facilitating, but it is not getting expected support from the state government. Meanwhile, West Bengal government said it has now requested the Railway Ministry to arrange 10 special trains to bring back stranded people into the state. Giving this information in Kolkata this afternoon, the State Home Secretary Alapon Bandopadhyay said that 3 such trains will operate from Bangalore and Hyderabad. He said that one such train carrying around 2,000 stranded people will leave Bangalore tomorrow. The West Bengal government said it has also requested the centre to take steps for returning of stranded people of the state from abroad. Opposition parties including BJP, Congress and CPIM have criticised the state government for delaying a decision on return of migrant labourers.
In Jharkhand, the migrant workers and labourers are returning from other states to their native place. About 22,000 migrant and stranded labourers have returned to their respective homes in Jharkhand from special Shramik trains. We have a report.
In Jharkhand, today 4 special Shramik trains from 4 different states of the country have reached at 4 different cities, carrying about 5,000 migrant and stranded workers stuck due to lockdown. A few hours ago, a special train arrived at Daltonganj station in Palamu with 1,017 labourers and their families from Ludhiana. The happiness of these labourers who have returned to their home after being trapped in lockdown away from their home for several days is clearly visible on their faces. Workers coming from Kurnool station in Andhra Pradesh at Barkakana junction of Ramgarh also shared the same views. They told All India Radio that they have all safely reached Barkakana in Ramgarh. From here, they are being sent to respective districts through buses provided with food and drink, face masks and sanitizers. They are thankful to the government for running the trains to help them return to their homeland. Today, 1,140 migrant labourers reached Barkakana junction in Ramgarh from Kurnool station in Andhra Pradesh. While on the other hand, a special train carrying migrant labourers will reach Bokaro station tomorrow. This is Shilpi for All India Radio News from Ranchi.
3 more private hospitals with a capacity of total 150 beds will reportedly provide treatment to corona-infected patients in the national capital. Delhi Health Secretary Padmini Singla in an order today declared that the government has roped in 3 private hospitals, namely Fortis in Shalimar Bagh, Saroj Medical Institute in Sector 19 Rohini and Khushi Hospital in Dwarka for admitting confirmed or suspected cases. Ms. Singla said these hospitals will have 50 isolation beds each and medical superintendents of these hospitals have been directed to make the isolation facility functional before coming Monday.
Maharashtra Minister of State for Transport Satesh Patil today said that government is starting free bus service from Monday for stranded people and students to return to their native places. The minister said the citizens and students stranded due to the lockdown can avail this facility by registering with the Commissioner of Police in urban centres or Tehsildar in case of rural areas. Patil said during the journey it is mandatory for all the passengers to adhere to the prescribed guidelines issued by the authorities. In another development, the Brihan Mumbai Municipal Corporation has put additional commissioners in charge of 7 zones in the city. Our correspondent has the details.
As per the order, 7 additional commissioners will work towards improving the double rate of positive cases from 10 days to 20 days by May 17th. These officials will be responsible for mapping positive cases, contact tracing, strict enforcement of norms in containment zones, door-to-door surveillance, and identifying senior citizens with comorbid conditions and fever clinics. They will also have to facilitate operations at private nursing homes, clinics, hospitals, ensure testing of symptomatic persons, and creation of COVID care centers. Additional commissioners will have to personally visit their zones every day from morning till 2 p.m., attend office post 3 p.m. and brief the municipal commissioner at 6 p.m. Of 19,063 COVID-19 cases in Maharashtra, 12,142 were reported in Mumbai and the city counts for 462 deaths from the state's toll of 731. Devvrat Bhattacharjee, AIR News, Mumbai.
AIIMS Director Dr. Randeep Guleria and Senior Medicine Specialist Dr. Manish Suleja took stock of the COVID-19 situation in Gujarat and gave expert advice to all the doctors for COVID-19 treatment. The team also held talks with Gujarat Chief Minister Vijay Rupani and appreciated state's efforts in building huge infrastructure for the treatment of COVID-19 patients in such a short span. Addressing a press conference, Dr. Guleria expressed concern over the stigma attached to COVID-19 and appealed people to come forward and having symptoms of the virus.
अगर उनको सिम्टम है जो कोविड-19 के हो सकते हैं, वो आगे आएं, अपना टेस्ट कराएं, अपने आप को अगर जरूरत है एडमिट करें, आइसोलेट करें, उससे उनकी जान भी बच सकती है और उनके जो घर के नियर और डियर वन हैं, उनकी सुरक्षा भी होगी क्योंकि अगर वो अपने आप को आइसोलेट करेंगे तो और लोगों में इन्फेक्शन जो है वो नहीं फैलेगा.
The Tamil Nadu government has formed a committee led by former RBI Governor C. Rangarajan to assess the immediate impact of the COVID-19 pandemic on the state economy. The committee is mandated with devising strategies to re-energize the state's fiscal position. Meanwhile, the total COVID-19 infected cases in the state has surged to 6,535 with the confirmation of 526 people with the disease today. A record 219 people have been discharged today, while 4 others died, taking the toll to 44. More from our correspondent.
The Tamil Nadu government has announced further relaxations in the lockdown conditions from Monday. Within Chennai, the working hours of shops selling groceries, vegetables and other essential commodities have been extended by 2 hours till 7 p.m. The standalone and neighborhood shops and private firms in the city are permitted to function from 10:30 a.m. to 6 p.m. Outside Chennai, they can operate from 10 a.m. to 7 p.m. Tea stalls in Chennai can reopen on condition that only parcel service is offered and sipping tea in the shops is prohibited. Petrol bunks are allowed to offer their services from 6 to 6 in Chennai and up to 8 p.m. outside the city. By the national highways, they will be open 24 hours. However, the state government has made it clear that the relaxations would not be applicable in containment zones, where the existing conditions will continue to remain in vogue. Jai Singh, AER News, Chennai.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. N.V. Padma, Head of Neurosciences Centre, All India Institute of Medical Sciences, New Delhi, has said that people need to stay home to stay safe and break the chain of transmission of COVID-19.
A virus has invaded our earth. It has invaded us. And there are zillion concerns. There are concerns about our survival, about food, about education, about career, about profession, about our movements. But these are questions for the first time in 3 generations that we are facing. But they're of relevance only if we are alive. To stay alive, stay home.
Dr. Neeraj Nishthal, Associate Professor Medicine in AIIMS, Delhi, tells why the lockdown is essential and why is it required to follow the advisories.
This is a new virus, so it has got a very big ego. It will not come to your house unless you go out and invite it. So stay home, stay safe.
Neelam Davey from Patna in Bihar has received benefits under PM Garib Kalyan and Ujjwala schemes. She expressed gratitude towards government for timely help during the lockdown.
मेरा 0 बैलेंस के खाता है, इस पर पैसा आया है, राशन उसन सब चीज मिल रहा है, प्रधानमंत्री जो भेजे हैं ना योजना से वो सब चीज मिल रहा है, वृद्धा पेंशन भेजे, गैस के पैसा भेजे, सब चीज मेरा आ गया है, इसलिए मोदी सरकार के अपना तरफ से धन्यवाद बोल रहे हैं.
Actor Amitabh Bachchan has appealed to the people to follow all directions and guidelines during the lockdown. He said that it is essential to come together to fight the COVID-19 pandemic.
नमस्कार, मैं हूं अमिताभ बच्चन. देखिए, हम सब मिलकर नोवल कोरोना वायरस या कोविड-19 को फैलने से रोक सकते हैं. इसके लिए हमें बचाव के कुछ तरीके अपनाने होंगे. खांसते या छींकते समय हमेशा अपने मुंह को रुमाल से या टिश्यू से ढकें. इस्तेमाल किए हुए टिश्यू को तुरंत ढक्कनदार कचरे के डब्बे में डाल दें. अपनी आंख, नाक और मुंह को हाथ से न छुएं. अपने हाथों को समय समय पर साबुन और पानी से लगभग 20 सेकंड तक धोएं. भीड़ भाड़ वाली जगह पर जाने से बचें. अगर आपको खांसी, बुखार या सांस लेने में तकलीफ हो रही है तो आप दूसरों से दूरी बनाए रखें. ऐसे लक्षण दिखने पर तुरंत अपने डॉक्टर से सलाह लें. अस्पताल में आप अपने मुंह पर मास्क या रुमाल जरूर रखें.
India's national broadcasters, Doordarshan and All India Radio, have assumed focus on comprehensive weather coverage from across the entire territory of the country. The weather reports cover details from every corner of the country, highlighting extreme weather conditions, temperatures of various places, from Kashmir to Kanyakumari, Gilgit to Guwahati, Palestine to Port Blair. We have this report on tomorrow's weather forecast.
The maximum temperature in the national capital tomorrow will be 40 degrees Celsius during the day, while minimum temperature will settle at 26 degrees Celsius. Delhi will witness partly cloudy sky with possibility of thunder lightning. Mumbai will see mainly clear skies with maximum temperature at 35 degrees Celsius. Minimum temperature in the city will be 26 degrees Celsius. In Kolkata, maximum temperature will be 36 degrees Celsius. Minimum temperature expected to be 26 degrees Celsius. City will witness rain or thunder showers with strong gusty winds. In the south, Chennai will experience a partly cloudy sky tomorrow with the maximum temperature settling at 37 degrees Celsius, while the minimum temperature is predicted to be 30 degrees Celsius. In the north, Jammu is predicted to experience partly cloudy sky with spells of rain or thunder showers. The maximum temperature is predicted to be 35 degrees Celsius and minimum temperature will settle at 24 degrees Celsius. Srinagar is predicted to witness partly cloudy skies with the possibility of rain or thunderstorm or dust storm. Maximum temperature is predicted as 23 degrees Celsius and minimum temperature as 13 degrees Celsius. Gilgit is predicted to face generally cloudy sky with light rain. Maximum temperature will hover around 29 degrees Celsius and minimum temperature will settle at 19 degrees Celsius. Muzaffarabad will also experience generally cloudy sky with light rain tomorrow tomorrow. Maximum temperature will settle at 21 degrees Celsius and minimum temperature is expected to settle at 12 degrees Celsius. Swati Rakheja, Newsdesk.
And now, before we end, the headlines once again. Massive evacuation operation Vande Bharat mission to bring back stranded Indians from abroad continues. 129 evacuees brought to Delhi from Dhaka. Nearly 850 flying back to Lucknow, Hyderabad and Kochi from Gulf countries tonight. And Health Minister Dr. Vardhan appreciates efforts of northeastern states in containing coronavirus pandemic. And with that, we end the special news program on COVID-19.